Thank you so much for joining me today for this presentation about Remediate Plus. My name is Dr. Mary Jane Hanlon, and I am the Senior Vice President of Promethean Dental Systems. For a little bit more clarity on my background, I have been trained as a dental hygienist and a dentist. I've worked in private practice for over 40 years and then joined Tufts University School of Dental Medicine as the Associate Dean of Clinical Affairs. In my role as Dean and President of the Massachusetts Dental Society, I have served as the liaison between the school and Dental Society to the Massachusetts Board of Registration in Dentistry. So let's get started, shall we? Promethean Dental Systems is very proud to partner with the American Association of Dental Boards to provide a reliable, fair, objective, and accurate remediation program. Remediate Plus is designed to help state boards in their mission to educate oral health professionals who may show signs of benefiting from additional training. Promethean Dental Systems is a simulation and training company. We advocate for a multimodal teaching model that integrates cutting-edge technology with didactic courses. We have created it as a standardized curriculum for all remediation needs and are able to customize it to specific professional requirements. Throughout this presentation, we will discuss how we are going to change the expectations of the remediation services we provide, how we are going to meet your expectations and requirements, and we will then walk you through the onboarding process to fit your state's needs. Finally, we're going to show you examples of a remediation schedule and our available courses. Remediation does span from one extreme to another across the country. From one extreme, where states allow their professionals to self-select or assign didactic continuing education courses that really do not prove completion or performance, to another extreme where dental schools deliver expensive, comprehensive programs that are one size fits all. This can be overbearing to the professional being remediated. PDS provides state dental boards with the ability to choose the courses that fit each professional's specific needs, tailoring a remediation curriculum that ensures evidence of completion and performance while providing results directly to the board. In our conversations with states across the country, you have shared with us about 65% of remediation services is related to professional behavior. Another 90% of clinical skill failures lead to a loss of licensure. While none of us really want a professional to lose their license, you as state leaders have the burden of protecting the public. Reviewing and assessing those hand skills with a professional is one way that PDS differentiates itself from other programs. Another way we differentiate ourselves is assessing the emotional intelligence of a professional. What we like to do is begin by analyzing the professional's behavior and the choices that the dentist or hygienist might make so that we can better determine their emotional intelligence. This insight is based on an emotional intelligence assessment tool called EQI. PDS has all candidates complete this assessment at the beginning of the remediation process. This assessment will help state boards determine other resources that might be necessary for complete remediation of this professional. Here you will see our 5-step process to remediation. This onboarding process is pretty simple. It can be altered to fit your state's requirements. The first step is the evaluation of the claimant's case. Your state board sends us the claimant's consent order, settlement agreement, or disciplinary order. Our team of doctors will then evaluate these documents and align on their recommendations for the remediation proposal. We will then provide you with insights on our evaluation of findings and propose remediation services tailored to fit each individual professional's needs. The PDS remediation proposal will then be sent to the state board for review. Ultimately, your state will make the final decision with respect to the remediation plan and the cost associated with that plan. Once a consent order and remediation plan are finalized, the onboarding process will begin. This process entails state boards communicating with the respondent or claimant, directing them to contact us for scheduling. A link will then be provided that will allow this professional access to our scheduling portal. From this portal, they will be able to pay for remediation courses. Finally, the respondent will schedule the course to fit into their time frame. We will then deliver the professional courses to the respondent, conduct our formative and objective assessments, and provide evidence of completion and performance to the clinician and the state board within 10 business days of completing. Here you'll see a list of some of our remediation courses that are in high demand: record keeping, ethics, overtreatment of caries, undertreatment of periodontal disease, endodontics, overtreatment of various disorders like TMD or sleep apnea, sterilization, and disinfection. All didactic courses have formative assessments on an array of required topics and clinical procedures that are delivered by professional dental educators. Classes provide a first of its kind simulation for each procedural area. Now here you'll see an example of a remediation case that we worked on. This is the remediation proposal that we sent back to the state board for its approval. Here you'll see that this particular professional had 4 separate complaints filed against them from the year 2005 to the year 2018. Below, where the colored lines are, you can see that we have taken each order and year and broken them down to the complaints and what was filed against this professional. On the 4 bottom lines, you will see that radiology, diagnosis, record management, and ethics occurred across each and every one of these years. What we did was we sent a proposal back to the state, and that state approved that proposal. We then scheduled the complainant, and here's the schedule that we customized to fit for them. You can see that this remediation plan totaled 5 days and included a behavior management assessment and a skill set evaluation. We also recommended adding courses on risk management, ethics, endodontics, prosthodontics, which was approved by their state board. Hand skills were evaluated using a multimodal approach, including mannequins and the virtual haptic technology that we possess. Again, we can tailor these courses and schedules to fit the professional's needs. Hands-on courses can be taken in any one of our training centers in Athens, Georgia, Coldwater, Michigan, or Memphis, Tennessee. All of the didactic courses are available online 24/7 and can be completed from their home or from their office. We want to take the time to assure all states that we recognize the challenges that they have had with the COVID-19 pandemic. And we do know that many of the cases that you have had were really difficult to deal with when everything was shut down. We want to assure you that PDS will not be shutting down and that we have taken every precaution from updating HVAC systems to ensuring that there is space and dividers between every Simodont. If we can, we try to provide a one-on-one visit for each of our candidates. Now, I'm sure you may have some questions, and if you do, please express them to your board leadership, and I would be more than happy to meet with you again to explain any of this information further. You will see on the slide that this is my contact information. I'm available both by email and by cell phone. Your EDs have been sent the following documents for your review: a copy of this presentation, a sample remediation proposal, a list of available didactic and simulation evaluation courses, an example of a passing professional's final report, an example of a failing professional's final report. I sincerely thank you for your time today and wish you a great rest of your day.